Good evening. My name is Sarah Khan, and I'm an organizer with Justicia for Migrant Workers. And we're here with Dr. Vanessa Redditt, and she will be talking to us about COVID vaccinations for communities with precarious status. But before we begin, I would like to acknowledge the land that we're on. So I'm coming from Windsor, and we also have other organizers coming from Toronto. So both Windsor and Toronto are on the Dish with One Spoon territory. The Dish with One Spoon is a treaty between the Anishinaabe, Mississaugas, and Haudenosaunee that bound them to share the territory and protect the land. Subsequent Indigenous nations and peoples, Europeans, and all newcomers have been invited into this treaty in the spirit of peace, friendship, and respect. Now, and without further ado, I would like to give it to Vanessa, Dr. Vanessa Redditt, to tell us more about COVID-19 vaccinations.
Hi, thank you so much for this invitation to speak to all of you this evening. Just as a little bit of background, I am a family doctor and I work at the Crossroads Clinic at Women's College Hospital in Toronto, and it is a clinic that serves newly arrived refugees. And so I've been speaking to my patients and many other community organizations and community members about the COVID vaccines. And this is really also in recognition of the disproportionate impact of COVID-19 on newcomers and refugees, that we see how because of higher exposure risk in workplaces, in housing, in crowded public transportation, that immigrants and refugees have experienced a higher risk of exposure and infection with COVID, and also morbidity from COVID as well. And so these conversations are so important because the vaccines offer protection. And so I've been having a lot of these conversations with patients and community members because there's a lot of information about the COVID vaccines, and sometimes it can be hard to sort through the different things that we're hearing on the news and in social media and from friends. And understandably, there are a lot of questions. And so I hope today what we can do is go through some of these questions. And these are addressing questions that I have frequently heard from my own patients or from other community members, and these may be reflective of the questions that you have about the vaccines as well. And in this conversation, I really do view it as a conversation. There will be an opportunity for questions at the end of the presentation. And all questions are good questions. And I'm not here to convince you of anything. I just hope that I can provide information so that you can all make choices that feel right for you. So to start off with, how do the vaccines work? This is a really common question. So there are 4 different COVID vaccines that have been approved for use in Canada. There is the Pfizer and BioNTech vaccine, as well as Moderna. Those were the first vaccines that came out, and they're known as mRNA vaccines. There's also been approval for AstraZeneca and Johnson & Johnson vaccines, and these are viral vector vaccines. As many of you will be aware, AstraZeneca right now has been put on pause in terms of its use for ongoing first doses in many provinces, including in Ontario. And although Johnson & Johnson has been approved in Canada, it's not yet available. So really, most of the presentation, I'm going to be focusing on Pfizer and Moderna vaccines because those are the ones that are currently available. That may change as we have more availability and more information about AstraZeneca and Johnson & Johnson. So, how did the vaccines work? Well, the basic premise is that the vaccines teach your body what the COVID-19 virus looks like so that you can fight it if you come into contact with it in the future. So you're all probably familiar with these little pictures of the COVID virus, and it has these little spike proteins on the outside. Think about it kind of like an ID badge. It says, I'm the COVID virus. So the vaccines are giving your body instructions, just a temporary set of little instructions of how to make a copy of that spike protein. It's almost like a recipe card or a little, Post-it note. Then your body, your cells, make a copy of that spike protein and they display it to your body. And your body's immune system, the system that fights off infections, says, hey, that doesn't belong here. And it starts to build up antibodies and T cells, these parts of our immune system that fight off infections. Now, those instructions for creating that spike protein and even that little copy of the spike protein go away, they're eliminated from your body, but what remains in your body is your immune system's memory of what that spike protein looks like. So then in the future, whether it's a month or 2 months down the line, that you come into contact with the COVID-19 virus, your immune system says, hey, I recognize that spike protein. That's a COVID virus. No way, you're not coming in to make me sick. And it fights it off. And that's how all of the vaccines work. There are just slight variations, but that's the basic mechanism. An important point and a common question is, well, these vaccines, the Pfizer and the Moderna, they have messenger RNA. Does that affect my DNA? Does that affect my genetic material? And the answer is no. The instructions for building that spike protein, they do not interact with your DNA. They are just going to kind of the kitchen or the workshop of your cell to make that spike protein. They don't get incorporated with your DNA, that permanent instruction book that's in your body. So your genetic material is not affected. Another common question is, can we get COVID-19 from the vaccine? And the answer is no. And the reason is that the COVID vaccines, they don't contain the COVID virus. And they only cause your body to make a copy of the spike protein, not the virus. Another important question is, how effective are the COVID vaccines? So right here, I'm going to give you some information about some of the original studies with the messenger RNA, mRNA vaccines, Pfizer and Moderna. And we have a lot of ongoing evidence that is coming out in how these vaccines are being used in the real world. So these studies were done actually back at the end of 2020, and they involved thousands of participants. So in Pfizer, there were 40,000 participants, in Moderna, more than 30,000, included individuals from the age of 16, with Pfizer, over 18, with Moderna, and people were given 2 vaccines. Okay, so what we're doing in these big scientific trials is half of the participants get the vaccine, and half of the participants get an injection that's a sulfide. It's a placebo. And then we follow those 2 groups to see if people get sick from COVID and also what kind of side effects they have. So what did they find out? Well, they found out that the vaccines were incredibly effective in protecting against getting sick from COVID, about 95% effective. And this was consistent across different age groups, gender, race, and ethnic backgrounds. So very, very, very effective. It's a little bit of information about AstraZeneca and Johnson & Johnson. I'm going to leave this off just because these are vaccines that are not available right now, but you can have this in the reference material. But the important point that I want to emphasize is that all of these vaccines are incredibly effective against severe COVID illness, against hospitalization, and against death. Pretty much 100% effective. Okay, so they're all these are excellent vaccines, and the ones that we have available, Pfizer and Moderna, they are both excellent, and they work basically the same way, same effectiveness. Now, looking at some real world data here, you can see how this is what happened in BC, where we look at cases of COVID among healthcare workers after people started getting their vaccines. And we see that case count of infections from COVID dropping way down. And this is the same type of evidence that we're seeing around the world. So these vaccines are really life-saving, and they are the key to getting us out of the pandemic. There are still things that we're learning about the vaccine, though. And this is where it can be confusing because there's new information emerging all the time. And that's because we're still learning a lot about COVID and we're seeing science kind of play out in real time. So we're still learning about how effective each of the vaccines are against new variants. There's evidence to suggest that Moderna and Pfizer are quite effective against the variant that was first identified in the UK, but perhaps less effective against the variant that emerged first in South Africa and in Brazil, but still provides some protection. We're still learning how long the vaccine will provide immune protection. Will we need booster shots? Will the booster shot be once a year or every 2 years? Or how long will those intervals be? We're still learning about that. And then we're also still learning how effective the vaccines are in preventing the spread of COVID-19. The data that I showed before saying that they're 95% effective in preventing getting sick from COVID, having any symptom of COVID, it is one set of data. We're learning how effective they are in preventing you from just getting the virus, not getting sick, but being able to spread it to somebody else. There's evidence to suggest that the vaccines can help to prevent the transmission, but we're still learning more, which means that we still have to follow all of the public health precautions that we know so well over the past year. So what are the side effects of the COVID-19 vaccines? This is a really common question. The main point is that they are similar to the side effects that we may have from other vaccines, like the flu vaccine or the tetanus vaccine. So the most common side effects are things like pain in your arm, where you get the injection, having some fatigue, feeling tired, maybe some achy muscles, a headache, maybe a little bit of nausea or tummy upset, a low-grade fever, sometimes even some swelling where the injection goes in. Very, very, very uncommon to have a severe allergic reaction, about 2.5 to 4 in a million cases. So very, very, very rare. The other side effects are things that you're familiar with, and you can use things like whatever, painkiller that you would normally use, acetaminophen or Tylenol, or things like ibuprofen or Advil to manage these side effects. Now, some people may ask, well, do we really know enough about the side effects of the vaccine and the safety of the vaccine? It's so new. And those are really good questions. I take a lot of confidence and comfort in knowing that these vaccines are being used around the world, and we're monitoring this really, really carefully. So those studies that I mentioned before, they were very large, thousands of people. But now, as of May 11th, 1.37 billion doses of vaccines have been provided worldwide, and we're watching those side effects. And of course, when I'm mentioning this number, there are more vaccine brands and types than the 4 that are approved in Canada, or really the 2 that we're currently using in Ontario, the Pfizer and Moderna. But there are millions of doses of each of those vaccines that have been used, and we're seeing the same evidence of these are really the side effects that people are experiencing. So another important question, are vaccines safe for people with certain medical conditions? The answer is that yes, if you have diabetes or high blood pressure or asthma or anemia, though it is safe and actually important for you to get the vaccine. It's even more important for people who may have heart conditions, because we know that those are the people who may become more sick if they become infected with COVID. The only times that we really say that there are special considerations of receiving the COVID vaccine are if you have an immunocompromising condition or an immunosuppressant medication. So something that weakens your immune system, either a condition or a medication. And we still really want you to get the vaccine, but it's just important that you have a conversation with your healthcare provider to figure out when is the best timing for you to get the vaccine, so that you have a strong immune response. So these are, when I'm referring to this, these are conditions like somebody has cancer and they're actively receiving chemotherapy, Well, we just want to figure out what's the best timing of when to receive the chemotherapy and when to receive the vaccine so that you have a good immune system response. Another important question is around the safety and recommendations of the vaccine for people who are pregnant or breastfeeding. So yes, it is safe and it is recommended. Organizations like the World Health Organization, the Society of Obstetricians and Gynecologists of Canada, and many other expert groups have come out saying we recommend that it is safe for people who are pregnant and breastfeeding to receive the vaccine. And this is because, there is no evidence to suggest that the vaccines would pose a risk for the pregnant person, for the developing fetus, for the baby who's breastfeeding, or for a person who's actually even trying to become pregnant in the future. There's nothing to suggest that there would be any negative impact on that person or the pregnancy or the baby. What we do know is that there are risks of severe illness from COVID infection, especially during pregnancy. And so we really want to ensure that pregnant people have protection against COVID infection so that they don't become sick during pregnancy. Other people ask, should I get the vaccine if I already had COVID-19? And the answer is yes. And this is because even if you've had COVID-19 in the past, we don't know how long you'll have immune protection from your own natural antibodies. And so we want to ensure that you have longer term protection through the vaccine. A really common question that we discuss is, how are the vaccines produced so quickly? And I think that this is a great question. Really, it is a story of collaboration and funding. So, this is a global pandemic, and international organizations and governments made funding available early on, made a lot of funding available so that the scientific research process could take place quickly. This allowed lots of scientists to be working on this problem, to find a solution. There was, in terms of international collaboration, it wasn't just funding, but it was also sharing information, sharing data. The genetic sequence for the COVID-19 virus was identified very early on, and then it was shared so that we could start developing vaccines against the COVID virus. We were able also to utilize existing messenger RNA, mRNA technology. So this technology has actually been around for several decades. So it was not about reinventing the wheel, it was adapting this existing technology to address COVID specifically. And a really important step is that there were efficient review processes and efficient data sharing. So instead of waiting for studies to be completed and then taking a break and then sharing that data with a health authority like Health Canada that reviews this data, the data was being shared in real time, and people weren't taking breaks. They were working weekends and evenings, and people were pushing this through. So it was more efficient, but no safety steps were skipped, and that's a really important point. People also often have questions about, well, were the vaccines tested in diverse populations? So right here, I'm just showing data that was in the publications about the Pfizer and Moderna studies that came out in December and reflected data from kind of the fall of 2020. And this shows who were those over 40,000 and over 30,000 participants in those big scientific studies. Now, what's listed on the side here, these are the terms that were used in those scientific publications. They may not be the terms that we use in our own communities, but I'm just displaying it as it was published. So people were able to self-identify their racial or ethnic background, and they could identify in more than one group. So you'll see here that about 79 to 83% of people identified as white, about 9 to 10% identified as Black or African American, about 4 to 5% Asian, 0.5 to 0.8 as Indigenous, 0.2% as Native Hawaiian or Pacific Islander, about 2% as multiracial, and then 21 to 28% identified as Hispanic or Latinx. And again, people could identify in more than one group, which is why it doesn't add up to 100%. So there were people from diverse populations, and the really important thing is that the vaccines were found to be equally effective in people of different racial and ethnic backgrounds. So what's in the COVID-19 vaccines? In terms of those messenger RNA vaccines, the medicinal ingredient is messenger RNA, okay? It's like that little set of instructions, almost like a little Post-it note that says, this is how you make the spike protein, okay? And again, those don't stay in your body, they're eliminated from your body. There are non-medicinal ingredients that include fats, salts, sugar, water. For those people who are interested in the chemical names, I've listed them here for Pfizer and for Moderna, so similar content. And I'll draw, well, actually, and I'll just briefly say for the viral vector vaccines, so this is for AstraZeneca and for Johnson & Johnson, which right now are not being used, but the medicinal ingredient is a modified adenovirus, which is a cold virus that has been deactivated. So it just is kind of a delivery truck for bringing those instructions for making the spike protein. That virus doesn't replicate, it doesn't cause you any problems. And the non-medicinal ingredients are similar: salt, acid stabilizers, emulsifiers, sugar, water. And again, these are the ingredients for AstraZeneca and for Johnson & Johnson. What's not in the vaccines? So there are no food products, no nuts. So some people have asked me, well, I've got an allergy to peanuts. Is it safe for me to receive the vaccine? And I say, yeah, absolutely, because the vaccines don't contain peanuts. And they also don't contain antibiotics. So similarly, if you have an allergy to penicillin or to other antibiotics, it's safe for you to receive the vaccine because it doesn't contain any antibiotics. It also doesn't contain any thimerosal, no formaldehyde, no fetal cells, and no microchips. I will draw your attention just to polyethylene glycol, PEG. And I'm only saying this because you may hear, about this chemical. So what is this chemical? Well, it's a common substance that is in the mRNA vaccine. So it's in the Pfizer and in the Moderna vaccines, but it's found in many, 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 many things. So it's found in laxatives. So if you've ever had a colonoscopy or you've ever taken something like Restoralax, Laxaday, you've had PEG. It's in a lot of cosmetic and skin products. And it's also kind of in the coating of a lot of common medications like Tylenol gel caps or Advil liquid gels. So it's not the Tylenol medication or the Advil medication, it's in the coating. And the reason that we draw your attention to this is if someone has had a severe allergic reaction to polyethylene glycol, to PEG specifically, then we recommend that you see an allergist so that we can figure out how to give you how you can receive the vaccine safely. But I have never met anyone in my life who has an allergy to polyethylene glycol, okay? It is so common that you've encountered it in your life and you would know if you have an allergy to this substance. So very, very, very rare. And if you think or if you know that you do have an allergy to this, it doesn't mean you can't get the vaccine. We just want you to have a consultation with an allergy specialist. Similarly, polysorbate is a chemical that's in the AstraZeneca and in the Johnson & Johnson vaccines. And again, it's a common substance that's found in things like ice cream and gum and other cosmetic products, and also in a lot of vaccines like the flu vaccine. And again, I've never met anyone who has an allergy to polysorbate, but if you do, then we recommend that you just have an appointment with an allergy specialist to figure out how you can safely get the vaccine. But again, this is very, very, very rare. So what about people who have existing allergies? What we recommend is that if you have a history of severe allergic reaction, so an anaphylactic reaction, like where your airway gets swollen and closes and you can't breathe, not just kind of a little rash or hives, but a anaphylactic severe allergic reaction, then we recommend that you just wait for 30 minutes after receiving the vaccine instead of the standard 15 minutes. And there are medical staff that are available at all of the sites to deal with those allergic reactions. And if you have an allergic reaction, we can come and see you. We can give you epinephrine. We can help you with those symptoms. So it is safe. And if there is going to be an allergic reaction, about 90% of the time it would happen within those 30 minutes. So you can feel very assured leaving the site that if you're feeling good, that you're not going to have an allergic reaction. Again, the only time that we really caution with receiving COVID-19 vaccines is if you've had a severe allergy to one of the ingredients, like the polyethylene glycol, and again, we have a plan for that, or if you've had a severe allergy to your first dose of a COVID vaccine. Okay, and then again, we just ask that you speak with an allergy specialist. So what happens after receiving the vaccine? Really important. We have to continue all of these public health measures. We have to continue social distancing, wearing a mask, washing our hands, and avoiding non-essential outings. And the reason is that it's possible that we still can carry the virus and we could spread it to other people. There's excellent protection after receiving 2 doses of the vaccine. There's more like partial protection after you receive just 1 dose. So we still need to practice all of these safety measures, these public health safety measures. It's important to also know that if you develop any symptoms of COVID, you still need to go get a COVID test, whether it's 2 weeks after you get the vaccine, a month, 2 months, these vaccines are excellent, but they're not 100%. So we still need to follow all of these precautions that we've been practicing and that we know so well from the past year. So what's the plan for vaccine rollout and who is eligible? Well, these announcements continue to change daily. It is moving along through age categories, and then health conditions, and then hotspots, and then workers who cannot work from home. I think the most important point that I want to make here is that the vaccines are free, and an OHIP card is not required to receive the vaccine, that you can receive the vaccine regardless of your immigration status. And in terms of more specific information about how to receive the vaccine, depending on where you live, we're going to follow up with some resources because it's hard to discuss it in a forum like this, and because the information changes so frequently. These are some vaccine sites that are a little bit more relevant to the Greater Toronto area. And we will send this out, and then there are more resources for people living in other jurisdictions. So I'm going to turn over to questions, but in summary, I hope that I've been able to explain how these vaccines are well studied, they're safe and effective, and that many people are at high risk of COVID exposure because of work conditions, because of crowded public transit, because of possibly housing conditions, and the vaccines protect you. And I am passionate about talking to people about the vaccines because of my confidence in the vaccines, and because I want people to have access to this protection. I have been having these conversations with my family, with my loved ones, with patients and community members, and I invite an ongoing conversation with all of you. So I think I'm going to open up to questions, but the last thing that I'll just say is that I'll also share what I think are some really great websites, also some multilingual handouts that explain the vaccines and that may answer some of these questions. So I will, I'm going to stop sharing and.
Thank you so much, Vanessa. That was great. So yes, we have the floor open for questions. Feel free to send us some questions on the chat, and we've left some description. So I'm going to be looking at my phone and my notebook because I have some questions here. So I think it's great that you shared some resources because there's a lot of fake news that's out there. And so actually, one of the questions I got was, what is a culturally appropriate resource that I can use to get the right information?
Yeah, it's a great question. And, I think that different sources of information work well for different people. So some people really like to read something. Some people really like to have a video. Some people really like having a conversation with someone they trust. And actually probably that last piece is one of the most important things. And so one thing that I can definitely share is I think those multilingual handouts that I referenced, they're available in about 15 different languages, and they go through some of the basics of the COVID vaccines, but also into some more detailed questions. And they've really, the questions have emerged from newcomer communities that a group of us have been working with. And so I would be happy to share those. And also we encourage people to use those info sheets, make a little, TikTok video or your own video, use that information on radio, use it in other conversations, share it in the ways that resonate with you and resonate with the communities that you're connected with.
Sounds good. We'll also share it on our page and maybe in our chat as well. If there's a vaccine offered, there's a couple of options, which one is the best vaccine?
Oh, this is the question that has been all over the news. So, I think that what we've been saying for some time is that the best vaccine is the one that's available to you. And at this point, the ones that are available right now, and this may change again in a week's time, but the two that are available are Moderna and Pfizer, and they are both excellent. They work the same way. They have a similar level of effectiveness against developing any symptom of COVID, against severe illness, against hospitalization, against death, like almost 100% protection against those really severe outcomes. And so they are both fantastic. They're both messenger RNA vaccines. And so, I think the conversation was a bit more nuanced when AstraZeneca was one of those options. I think many of us would still say, if you're at high risk from COVID, that getting the vaccine, whichever vaccine you can as soon as possible, is the best choice, because you're much more likely to become sick from COVID if you're in a high exposure living setting or work setting. But I think my answer to that is whatever vaccine is available is a great vaccine to get.
Okay.
And again, that really the difference between Moderna and Pfizer is like, there's hardly any difference between them, just different companies making them.
Okay, so it provides protection against all variants.
So that's a really good question. The protection against variants is something that we're learning about. So think about Pfizer and Moderna as like Coke and Pepsi. It's the same flavor. I don't know. I can't really taste the difference. Maybe some people can. I can't. But it's the same. It's the same drink, right? It's just like probably they're even more similar than Coke and Pepsi. And so that's that. In terms of the protection against variants, we're still learning about the protection against variants, because when the vaccines were studied back at the end of 2020, in the fall of 2020, there wasn't that same prevalence of variants as there is now. and there are new variants that are emerging. So I'm not able to actually give you a, well, this is the percentage against this variant, because that data is still kind of emerging. And so I guess to answer it, in the studies, the vaccines, Pfizer and Moderna, were found to be about 95% effective against developing any symptoms of COVID. But those studies were done at a time where there weren't really the variants circulating in the way that they are now. So is it as effective as 95%? No, not against the variants. I think we're still learning, but they're still providing some protection, and some protection is definitely better than no protection. And what we're seeing in real life data is the protection against getting really sick from COVID. So if you just get COVID, but you sort of have a stuffy nose and a sore throat, well, that's inconvenient. But what the vaccines really protect against is that you don't get really sick and hospitalized and intubated from COVID.
So if I'm fully vaccinated, does that mean I still have to wear a mask?
For now, yes. And the reasons for that are a few. One is that it's excellent protection, but it's not 100%. The other thing is that we don't know how much the vaccines will protect against us spreading it to other people. So you may not even know that you have COVID. The data is suggesting that there's quite a bit of protection against transmission, but not 100%. So we need to keep doing these measures to protect other people as well. It's not always going to be this way. When more and more and more people are vaccinated, then COVID infection rates drop. And then when there's less COVID circulating in our communities and in the world, that's when we can start to remove our masks and to hug. And so it's on the horizon, but we're not there yet. And the important thing is that we don't want to let our guard down now when we're in kind of the final stretch.
Okay. I have another question here. So I am worried that I will get one vaccine in Canada and the other one in my home country. What are the potential impacts on my health?
Yeah, that's a great question. And there's active research right now about mixing and matching the vaccines. There's evidence to suggest that right now what we've wanted is for people, because this is how the studies were done, that you got your first dose of Moderna, you get your second dose of Moderna, first of Pfizer, second dose of Pfizer, because that's how the studies were conducted. However, in the real world, things are changing, and there's studies right now to look at, is it effective to get a dose of Moderna and then a dose of Pfizer, or a dose of AstraZeneca and then you get a dose of Pfizer. That's an active area of research. The initial data suggests that yes, that should be safe and effective, but I think we need a few more days or maybe weeks to get an even better answer to that. But I think I just saw a news article today saying, there's good evidence coming out that should be safe and okay. But we need to study that a bit more.
So in the moment right now, should people be mixing and matching vaccinations?
No, for now, we should follow the public health guidance and the scientific guidance that if you've received your first dose of Pfizer, then you receive your second dose of Pfizer. Now, like everything with COVID, that may change in a month's time, or in even a couple of weeks. They might say, oh, you know what, it's okay. So it's all, what's really interesting about COVID is that we're seeing science play out in real time. This is how research always happens. You get new evidence, things change, but what's happening is we're watching all of this like on our news feeds and on our TV screens, and we're having these conversations. So this is all kind of normal, that we learn things, we adapt, guidelines change. But for now, yes, we follow the public health guidance that you should be consistent with. If you get one dose of a certain vaccine, your second dose should be the same. But what I'm just saying is that in a week's time or in 2 weeks' time, that there may be a different scientific recommendation, and there may be more flexibility around that. But for now, what we do is we follow our scientific leads who are guiding this.
Okay, sounds good. I have another question here. What assurances do I have that my medical information will not be shared with immigration or my boss?
This is such an important question. And I wish that I had a firm answer to say that the government has promised not to share your information. We have been, many advocates have been requesting that.
Mm-hmm.
And they have not come out with a public statement to say, we will absolutely never do that. But here's what you can do, is when you are going for your COVID vaccine,
Mm-hmm.
all you need to provide is a name, a date of birth, and a way to contact you for your second dose. That's the minimum required information. And I think your gender. So you don't need to provide your phone number or your email. You can provide that phone number or email of somebody that you trust.
Mm-hmm.
You can actually, I mean, they just need a way to say, okay, you know, Vanessa Redditt received her vaccine, her first dose, and she is getting notified in 16 weeks to get her second dose. I mean, I could put my name in as Vanessa Jane,
Mm-hmm.
actually, and I just need to say the next time that I go, I'm Vanessa Jane. So that's the way to they don't really need to know more than that. They just need a name, a date of birth, and a way to contact you, and then for it to be consistent with your second dose. The other thing is that there are clinics that are being identified as safe clinics, access without fear, low barrier, that are very attuned to these needs. And so they will be very sensitive in saying, you know, just you can give me a piece of paper. I just need to see like some name. Just tell me what name you want me to put in. And I can even, you know, we can put in the agency's phone number as your phone number, and then we'll call you when you're up to get your second dose. Mm-hmm. So again, that's some of the information that we can provide, is where those safe clinics that you can really trust. But the way that, in order to get the vaccine, there is this database that's being used, which is not, at this point, it's not being shared with immigration enforcement. It just exists to track these doses of vaccine, how many people got the vaccine, how many people got their second dose. So we don't expect that it will be shared with immigration enforcement or anyone else, but it's just that the government, like, I just have to be clear that we've requested the Ministry of Health to say, we will not share this, and like never, and they just have not come out with that statement. So there's the workaround is you only provide the information that you feel comfortable providing. So you can use a different name.
I was actually going to say, because I just got my first dose and I was asked for my OHIP card. So if somebody does not have a card or is not comfortable sharing their, their OHIP card, is the clinic a better option for them?
So there are different sites, and so when they ask for your OHIP card, part of it is because it's easier to look up, you know, your name and link things into your health record, like your provincial health record. They really should not be saying, "Can I see your OHIP card?" They should say, "I need to confirm your name. Can you show me something that has your name so I can spell it correctly?" If you have an OHIP card, that's ideal, that's best, but you can really show me anything. And you can show me, you know, a letter that says, "I'm Vanessa Redditt. Here it is." Like there really is, and this is a provincial mandate from the Ontario government, that there should be flexibility in that. What's happening, however, is that at different clinics, they're not necessarily always implementing that policy. And so some, you know, a front staff member might say, "Oh, can I see your OHIP?" And, "Oh, I have to put this information in," and they don't. And so that's where I think actually knowing some of your rights can be helpful, just to say, I only need to give name, date of birth, way to contact me, and gender. That's it. And then the second thing is you may feel more comfortable going to certain vaccine sites that have really committed to saying, we want to offer vaccine access without fear to migrants, and that they understand those issues. And we're working to kind of build up a list of where are those places that they've said, yeah, we get this. We're going to respect these principles. We're not going to ask you for OHIP. We can put in a different name. So that's something that we'll share. I think, and sometimes maybe it's also word of mouth to know, okay, yeah, I went to this place, and people can share that. Yeah, I felt comfortable. They were cool with this. So there's ongoing advocacy that we need to do.
Yeah,
But,
absolutely. Because I was going to say, they asked me, they wanted a government issue ID and they wanted my address there. And so that may not be an option for everyone.
Right. And what I've been working on, especially in the GTA, is to say, you don't need somebody's address. Like, okay, if people want to share their address, that they can, but for many people, they may not feel comfortable and may not want to share their address, and that is okay. You don't need to. And so, I think that we need to do ongoing work to ensure that these policies are being implemented at every single clinic that's offering vaccines, and that every single staff that's working at them knows this. But unfortunately, it's just happening so rapidly that I think a lot of staff are not even getting trained in this. So they just are going through the computer program. They're like, okay, and next thing I have to enter in is name, and next thing is address. And they're not really thinking about the implications of that.
Okay. So I have another question here. Several workers have died, and I'm worried that the vaccination may lead to my death. What should this person do in this circumstance? Should they accept, getting vaccinated?
Yeah, I just first want to acknowledge the pain and sadness and grief in these tragic deaths. I'm so deeply sorry and so deeply saddened. I think what I would reflect is that the vaccines have been found to be very, very, very safe. No reported evidence of any vaccine causing a death, in terms of, especially when we're looking at Pfizer and Moderna. The risk is really with COVID. And the other complicated thing is that, yes, we are seeing some people who are getting sick with COVID after receiving their vaccine. But what can happen is you might have been exposed to COVID on Monday, got your vaccine on Wednesday, get sick on Thursday, and the sickness is not because of the vaccine, it's because on Monday you were exposed to COVID. And the protection from the vaccine, you really don't have it until at least 2 weeks later. And you only have partial protection after getting your first dose. So what I would say is that what we know are the big, big risks are the risks of becoming sick from COVID. And so I would, strongly, and from my heart, recommend that if you have the opportunity to get the COVID vaccine, to receive it. I can say I feel very fortunate that I had the opportunity to get my vaccine because I'm a frontline healthcare worker working with people that are sick with COVID. So I've received my 2 vaccines. I was on one of these webinars maybe about a month ago, and I actually burst into tears because I got a text at the same time that my mother and father had received their vaccines. And I just realized how much I'd been worrying about their safety over the year. And so I say this as I would to a family member, that I trust the vaccines and I want people to have access to receive this potentially life-saving protection.
So if somebody develops an allergic reaction after their first dose, should they go in for their second dose?
Great question. It really depends on the type of allergic reaction. So, if you have a severe allergic reaction, like can't breathe, again, typically if that's going to happen, and that's about 2.5 to 4 in a million chance that would happen, that it's going to happen while you're at the vaccine site, and somebody's going to be there to help you.
Mm-hmm.
If that happens, then what we would recommend is before you get your second vaccine, that you talk to a healthcare provider, and they're going to help to connect you to an allergy specialist who can do some testing to figure out, was that because you ate a new tuna sandwich at lunch, or was that because you got the vaccine? Like, they'll do testing to figure that out and figure out how you can get a second dose safely. If it's a reaction where it's more like you get some spots on your skin, if you're kind of itchy or something like that, we would recommend it's still safe for you to get your second dose.
So should I be worried about blood clotting?
Great question. So there's been so much about blood clots on the news. The concerns about blood clots were related to the AstraZeneca vaccine. So there have been no reports or concerns about blood clots with the Pfizer or the Moderna vaccines, the ones that are currently available. And in terms of the blood clots with AstraZeneca, the risk is very, very low, but it's not zero. And so that's why they've put a pause on AstraZeneca for now to further investigate, what are the actual risks of developing a blood clot, what age groups, like, can we better figure this out, how to treat it, how to predict it? And so it's been put on pause while those questions are answered. Millions and millions of people around the world have received AstraZeneca safely without having any clotting concerns. And I think that there's a possibility we will reintroduce AstraZeneca. It's hard to say, but what's happened right now is that we have a good supply of Pfizer and Moderna coming in. So the government has chosen to say, well, if we got a good supply of Moderna and Pfizer, and there's no risk of blood clot with these ones, then let's just go with Pfizer and Moderna for now while we figure out this AstraZeneca data. So the answer to the question is there's no risk of blood clot with Pfizer or with Moderna. There's a very small, which are the ones that are going to be currently available in Ontario. There's a very small risk of blood clots with AstraZeneca, and more information will be coming out about that and how we might use that. I think the one thing that I really want to express is that if people have received the AstraZeneca vaccine already, that was still a great choice. It was an excellent choice because the really, again, that risk of blood clots is incredibly small. And what you've done is you've given yourself protection against COVID that has a much, much higher risk of not only blood clots, but of many other severe complications. So it is a good choice. I am happy that people got the AstraZeneca vaccine. And I don't think that people need to excessively worry if that was the first dose that they got. And if there is going to be any type of clotting issue with the AstraZeneca vaccine, typically that would happen within 4 to 28 days of receiving that vaccine.
Oh, I was going to actually ask you about that.
Yeah.
Okay, perfect. So people who've already got their AstraZeneca and it's been like almost a month, they shouldn't worry about getting a blood clot.
Exactly.
Okay. Now, how does the vaccine interact with other medications if the person has pre-existing conditions?
Great question. So it is safe for you to get the vaccine, even if you're taking other medications or if you have other health conditions. Those big studies that I talked about, they included people with heart disease, with diabetes, with hypertension, high blood pressure, with anemia, with asthma. So it is safe and recommended. People were taking different medications. There isn't an interaction. The only time that it's not an interaction, but it's just a consideration, is if you have either a health condition or you take a medication that weakens your immune system. So again, somebody who has cancer and they're receiving chemotherapy, which weakens your immune system. Or maybe you have something called psoriasis and you're on a medication, which we call biologic, that lowers your immune system. Or you're on long-term doses of oral steroid pills, like prednisone pills, and you're on like 50 milligrams a day. So those things lower your immune system. And so what we recommend that you do is that you talk to your healthcare provider about what's the best timing of, receiving the vaccine, because we want your immune system to be at its strongest point so that it can build up a response when you get that vaccine. So what we would say is, let's say you get, a medication, these specific immune suppressant medications. Every 2 weeks, we would say, just wait for 2 weeks after you've received that medication so that your immune system is getting stronger and that you get the vaccine when your immune system is strongest. So it's just a conversation about when. But let's say you're on a blood pressure medication or diabetes medication or heart medication, or you're on puffers. It is safe for you to get the vaccine. There isn't an interaction.
Okay, that's really good to know. Because then you're still eligible to get or potentially be able to get a vaccine. It's just a matter of when you might be best equipped to deal with the symptoms of the vaccine.
Exactly. And when it's most effective for you to get the vaccine is really the issue. And again, that is a small number of conditions. The most common conditions that people might have: arthritis, diabetes, hypertension. You can get the vaccine. It is safe. The timing doesn't matter. Well, the timing matters. It's to get it as soon as you're able to. That's the best time to get it.
Okay. I have another question here. I don't want to get the vaccine. Should I still get the vaccine if I don't want to?
Yeah, I mean, when I speak to my patients, I always say, your body, your choice, right? I don't think anyone should be forced to do something that they're not comfortable doing. So I think that it's, if you're not ready to get the vaccine, that there isn't any rule that says you have to get it. What I may recommend is that, if you're not comfortable getting the vaccine, maybe there are ongoing questions that you have, or maybe there's information that's been confusing. And so maybe a conversation with somebody that you trust that can provide accurate information about the vaccine might be helpful to answer those ongoing questions. The other thing is that, we want to make sure that the more people that get the vaccine, the more that we're all protected. So it helps to protect you, but ultimately it helps to protect other people. I guess the one other consideration is there aren't these rules right now, but it's possible that there may be some requirements to have proof of your vaccine for certain jobs or for certain travel. So there may be a possibility down the line, I don't know, these things are emerging, that you may need to show that you got a vaccine in order to get on a flight to certain places. It's a possibility. People are talking about vaccine passports. So I think that that may happen. Within healthcare, I think that there may be a possibility that at a point, we all have to get our flu shot. Otherwise, we have to wear a mask during the flu season. So there may be a possibility that they'll say, if you haven't received your COVID vaccine, then you have to continue wearing a mask, in the future when we're allowed to do without this. Or they may say, there may be restrictions on you working with people that have weakened immune systems because they want to make sure that you don't pass it along. So I think that there's just those considerations. At this point, I think that it's important that people feel ready and comfortable to receive the vaccine. That you shouldn't be forced to do something that you're not ready to do.
Okay. Well, these are all the questions I have. Do you have any final advice?
I would just say, I think these conversations are really important, and that it is very understandable that people have questions about the COVID vaccine because there is so much information that is floating around, and it can be difficult to discern what is reliable information and what is not reliable information. So it's very natural to have questions. And I'd also say that it's very understandable that people may have a lack of confidence in the healthcare system and in the government, because we have a long history and an ongoing story of people being mistreated, of being excluded from healthcare, of not being able to access the benefits that they deserve. And so I think that these conversations are really important. And I empathize that people have some mistrust, and that is because there has been mistreatment and there has been an erosion of trust. And it is on our responsibility as healthcare providers and the responsibility of healthcare institutions and of the government to rebuild that trust. So I want to say I welcome an ongoing conversation about this. And, if we want to talk another time, or if you want to send me questions, I'm certainly open to that, because I want people to feel safe and supported in getting the information that's going to help them make the decisions that feel good in their lives.
Thank you so much for all your insight. Really appreciate it.
Thank you, everyone.
All right, that's all we have. We're going to have another webinar next week, so stay tuned.
Okay, thank you. Stay safe, everyone.